We're seeing a steady spike in COVID numbers in some places, some states around the country, and worldwide as well. So what's behind the surges? Dr. Suman Radhakrishna is an infectious disease specialist with Dignity Health California. Joins us now. First off, doctor, thank you very much for joining us.
Thank you for having me.
So let's talk about this spike. Some cities here in the U.S., some states, but then in Brazil, where 35% vaccination rate, they're seeing a spike there. What do you think is behind this?
There are a lot of things happening in Brazil which are unique to that country. The first thing is there is a variant which is called P1. The issue with P1 is it's more contagious. It seems to be infecting the younger population and middle-aged population much more than the older people and causing deaths in that middle-aged population. And the third thing is, social distancing and mask wearing has kind of become lax, probably because of fatigue. And the vaccine is not as effective. The Sinovac, which is the Chinese vaccine, is only 50% effective. And the uptake for vaccination has not been as widespread. So it's a combination of factors that has resulted in this so-called perfect storm situation where you have a lot of people who are marginally practicing social distancing and keeping their space, and it's affecting the younger people who are going out and are more likely to be exposed, and the vaccine is not working very well. And then the last thing is P1 seems to also be infecting people who had COVID last year, so they are at risk for getting reinfected. So everything is adding on in Brazil.
Okay. Referring now to the U.S., some of the COVID variants here appear to be infecting school-age children. What factors might be contributing to that, and what can we do to protect our kids? And will a vaccine, if and when it gets approved for kids, will that help?
The variant that is predominant in the United States right now is the British variant, the B.1.1.7. And this one is more contagious and needs fewer virus particles to infect. And that seems to be what has been spurring the higher incidence of infections in school-age children. We're not talking about the very young kids, but you're talking about the middle school, the younger high school kids. Right now, we have vaccine that is the Pfizer vaccine that is approved for people who are 16 and older. So the upperclassmen in the high school should all be eligible for vaccination starting this week. Now, for the younger kids, Pfizer is in the process of working and getting approval between 12 and 15. But while we wait for the 12 and 15 age group to be approved, all adults around these children, if they're vaccinated, then the herd immunity goes up. So it's like a zone of protection around the kids, and the adults are not bringing in infection to give to those children. That's what we can do right now.
Well, and you mentioned herd immunity, which is what we've been hoping for so very long. What are you telling people who are still a little bit resistant to getting the vaccine? Are they hindering us getting to herd immunity?
Initially the hesitancy for vaccination is significantly higher, and it has started to come down now. And because more number of people have been vaccinated, they've had their friends, family members being vaccinated, they've seen what the vaccine can do in terms of side effects, and so the uptick for receiving vaccination has improved. And we do need herd immunity because not all of us respond very similar to each other when it comes to being vaccinated and getting the antibody titers. People who have immunodeficient conditions or people who cannot mount a good enough immune response are less likely to respond. So think of it like this. The person who is most susceptible, if they're in the center of a circle and all of us are around and we are all vaccinated, we will protect that person in the center of the circle. So when we get the herd immunity up, then the people who have not mounted an adequate response and people who are not vaccinated because they have other medical issues will all be protected because of us, because we have gotten the vaccine, and that virus does not have an ability to have any hold in our community. So that is what is most important. And we should push and convince all our friends and family members to go get vaccinated. And once the vaccine is approved for the age group of 12 and 15, we should also have our children go out and get vaccinated.
Okay, that's a very good explanation. Thank you. Thank you for your time and for joining us this morning, Dr. Suman Radhakrishna. Thanks again.
Thank you for having me.
Okay.